Good afternoon and welcome to Arkansas Children's. I'm Rebecca Brockman and today I'm joined by Dana Thomas. She is an RN3 CPN with our pediatric sedation team, and we're going to find out more about pediatric sedation this afternoon with Dana. Arkansas Children's was recently designated a Center of Excellence in Pediatric Sedation by the Society for Pediatric Sedation. That's a lot of words, Dana. Basically, what we want to get down to today is how it's helping patients and families at Arkansas Children's, but it is a big deal and it can mean a difference for your child and their experience here. So first, let's start. I'm not on the clinical side, so I asked you before we started, what exactly is pediatric sedation?
Well, sedation is essentially a state of depressed consciousness. So what that means is we might give a medication to help calm your child or to essentially help them to sleep. So essentially it's helping them be calm and free from anxiety and just get the procedure or test done that they need to get done.
And so along those lines, are there different levels or amounts of sedation that you would give a patient?
There are. So every child is different. So we kind of determine once we meet them and kind of get their history what kind of sedation they need. But there's minimal sedation, moderate sedation, deep sedation, and then general anesthesia.
Okay. So what are the differences in having sedation versus anesthesia?
Well, one thing is our doctors are made up of critical care and ER. They're all attending, so they're all top level physicians. And in most cases, parents can actually stay in the room with the child when they're getting a procedure. So that's a little bit different than it is with anesthesia.
And can you give us some examples of procedures or times when a child could be a good candidate for sedation?
Yes. So basically, anyone that is a healthy child, we like to say ASA 1 or ASA 2. What that means is a healthy child or a child with some mild disease, such as it might be a child with leukemia, or it might be a child that's getting a scan because they have headaches, that kind of thing. Typically, those kids that are essentially healthy, that have a good airway, they don't have lung problems, they don't have heart issues, generally those are kids that are safe for us to sedate.
Okay, so if moms and dads are watching at home and they find out that their child is a candidate for sedation, how can they help their child prepare at home before they come to the hospital?
So first thing I would say would be honest with your kiddos. Tell them what they're coming to the hospital for. They're having pictures made or they're having a test done. And there are lots of videos online that they can watch that will help them prepare. I would also say bring something that gives them comfort, like a blanket or a toy. And mainly what we love, distraction is our best helper. So if they have something that they like to watch or listen to or sing while they're getting ready for the procedure, distraction is our best aid.
Okay, I like that idea about talking to your child before they come to the hospital about what to expect. So how does pediatric sedation help patients and their families?
I think one of the ways it helps, families can stay together a lot. Also, we kind of try to take care of the family as a whole. We talk to parents before and after, and of course during procedures, trying to find out what helps their child best, ways to help their child, and just kind of keep them involved in the procedure.
Okay, and if you're just joining us, we're glad you're here. We are live at Arkansas Children's, and we are talking about pediatric sedation with Dana Thomas. She is a nurse with the pediatric sedation team, and they were recently accredited in pediatric sedation, and only 10 children's hospitals nationwide hold this accreditation. So Arkansas Children's is definitely one of the top tier, one of 10. So let's talk about recovery after sedation. Mm-hmm. If a child is given sedation, has a procedure, then what happens?
So typically the recovery is very short with sedation. We use a minimal amount of medications. So usually recovery time is about 15-20 minutes, and then they wake up, and as soon as their little eyes are open, they can eat and drink and go home. So it's a pretty fast turnaround.
And how does that compare if they were under general anesthesiology? How does that?
So the nice thing about sedation team is actually we kind of try and stay localized in a central area. So if we say, for instance, she's having an MRI, they come down for the MRI, the child has MRI, and they recover all in the same area. So they're staying with them most of the time. Same thing as if they're a hematology oncology patient, they can stay in for the procedure and they're in recovery there with them as well. So they don't have to go to a recovery room, they don't have to go to other units to recover or get ready. That's all there together at the same time.
Excellent. So 15 minutes and then they're awake and the child feels
good. Most of our kids do not have any kind of nausea or vomiting, so we let them eat because eating makes them happy after they've been in PO for so long, and it's usually a pretty good recovery.
Okay. For the parents who are watching, is there anything else that they need to know to make this experience a success?
Pretty much what I would say is we want everyone to be a part of the sedation. Parents, we value their input definitely a lot. So if you feel like there's something that would help your child with the sedation, we absolutely want to know about it. We want to treat the family as a whole. We know it's stressful. The procedure is stressful, the thought of going to sleep is stressful, so we're trying to make that as easy and as timely and as pleasant as possible.
Excellent. And if you have any questions as you're watching this now or later about pediatric sedation, and if your child could be a good candidate, please leave them in the comments below, and we'll make sure that Dana gets the questions and we'll get them answered. I guess just in closing, Dana, if you could just kind of reiterate what you've shared before, how pediatric sedation helps both our parents and families and our patients.
I think it just helps, and families get to spend more time together. We treat everyone as a family. In fact, I tell kids when they go into the rooms, or if parents can't be with them, I'll be their mom until they're back with their moms for any reason. But we just try to make them part of our own family while we're there, and take care of them the best we can and make it as pleasant as possible.
Well, congratulations again to the whole pediatric sedation team, Dr. Dalby, and the whole team for this accreditation in pediatric sedation. So thank you for your time, and thank you for watching.